Okay, I think let's get started. I'm sure we'll have some other people joining in a little later, but we don't want to run over because we realise this is lunchtime. So thank you everyone so much for joining us today for the launch of our new guide, Your Guide to Menopause. We're really excited to have everyone to join us for this event. Before we get started, I'd just like to introduce myself and the rest of the panel who we have today. So my name is Bethany Appleby. I am Sexual Health Lead at BHA for Equality. And I was part of the design and the research for this guide. I'd like to pass on to my colleague Megan so she can introduce herself too.
Hi everyone. Yeah, I'm Meg. I'm also one of the sexual health leads at BHA for Equality. Also worked on the menopause book with Beth.
And Alison.
Yeah, hi everyone. I'm Alison Pye. I'm a consultant in public health working at NHS Greater Manchester.
Thank you so much, Alison. And Sheni.
Hi everyone, my name's Sheni. I'm the Assistant Director for OD and Good Employment, also from NHS Greater Manchester.
Lovely, thank you so much. So let's just get started. Thank you so much to our panel for joining us today. So just a couple bits of housekeeping before we get into the fun stuff. So for everyone to know that today this event is being recorded. So if you don't wish for your video to be recorded, please just keep your video turned off. If everyone could keep themselves on mute, that would be fantastic. And in terms for questions, there will be a Q&A at the end. So if you do have any questions, what you can do is pop them in the chat. And then once it comes to the Q&A, we will answer them. Or if you just wanted to hold off till then, that'd be lovely. So just a brief overview of the schedule for the next hour. So for the first 20 minutes, we will be introducing the guide. At 1:20 to 25, we've got an amazing video of the women who supported us in the research for this, talking about their menopause story. Then we'll have Alison talking about Hive's holistic approach. And then finally, we'll have Sheni talking about the GM Menopause Network. And then we'll have 15 minutes or so at the end for some questions. So I'm going to start just talking a little bit about BHA for Equality. So we are a charity that addresses health inequalities with minoritized ethnic communities. We, in part of the sexual health team, we offer a few different services. So one of the main services that we offer is we do free HIV and STI testing. We do this in the community, so we have different clinics across Greater Manchester that are really easy to book and help make sexual health services a little bit more accessible. We offer training for healthcare professionals, organisations, charities and workplaces. So this training could be HIV awareness. We do menopause training and completely sorry, classic. I've just blanked on the rest of the training, but we do offer a variety of training. Oh, there we go. We have an amazing resource called HIV in the Workplace that looks at how we can discuss HIV in the workplace, and that's another part of training that we offer. Typical, I'd forget this during a menopause session. We also offer free condoms and lube. We do community outreach and engagement, and we have an amazing new service, which is our PrEP fast track referral service. So if we meet someone in the community, we can help fast track them for PrEP, which, for those who don't know, PrEP is a medication that can help prevent HIV. So one of the things I love about working for BHA is that we have a community-led approach to sexual health. So we really aim to meet the needs of the community. And the way that we do this is that we speak to people in the community to gauge an understanding, identify any health gaps in knowledge around sexual health. And we really take a holistic approach. We truly believe that sexual health is connected with mental health and physical well-being. So we like to look at the person as a whole, not necessarily just your sexual health. And one of the things we really aim to do is we aim to make sexual health services accessible. And we do that through our community services and our testing. On top of the menopause guide, we have some other fantastic resources. So we have a guide on contraception that is available in Hungarian, Romanian, French and Arabic. We have our HIV in the Workplace guide, which is a fantastic guide. We have a guide to STIs that's available in Portuguese, Farsi, Urdu, and wow, this is embarrassing. I keep forgetting this. And then we also have other things on sexual health testing. And now we have our new menopause guide. So let's talk about why menopause. Why did we create this resource? Well, I've been working for BHA for about 3.5 years now, and I would say it is one of the biggest conversations I have had in the community. Every time I'm at library, whenever I'm speaking to women, it is such a big conversation. And that's because menopause can have such a huge impact on women's lives. It can affect their work, their family, their relationship, and their mental health. Hormones can have such a big impact on us, and it's really important that we talk about this and we educate women, because a lot of the time people's mums weren't educated, and then no one's able to educate their daughters. And that's the wonderful thing about education. It's passed on through generations and through friends. And one of the things we have noticed is there's a really big taboo around menopause. There is a lot of shame and stigma. And one of the things is that most languages don't have a word for menopause. When we were translating this guide, we had to speak to our translation services about how we were translating the word menopause, because some of the languages were just old. One of them was the age of despair, just these awful things that really stigmatize this very natural period of life. And so we want to celebrate it and help women by giving them the information that they need. One thing that came out through the research is that everyone's experience is different. There are over 35 symptoms of menopause, and we're actually starting to see there's possibly even more. There could be up to 50, because hormones really affect our health in all aspects. We found women were being misdiagnosed with depression. They were given antidepressants because their healthcare professionals weren't looking at the whole picture of menopause, because it wasn't until their mental health was really being affected that they came in and spoke to their GP. And a lot of the time, women aren't aware of the support or management options for menopause. So when we started doing this work, we really wanted to take a holistic approach. We wanted to look at how can we manage menopause from all aspects, rather than just let's talk about HRT. How can we look about mental health, physical health? How can we look at supplements and diet? So that will lead me on to my colleague Meg, who was a big part of designing this guide and was one of the people who wrote it. So I'll let Meg pass on. If you just want to let me know when to go next, Meg.
Yeah, will do. Thank you. Thanks, Beth. Yeah, I'm Meg, and I'm going to talk a little bit about the development of the guide with women from minoritized ethnic communities and what that process entailed. So just go ahead, please. Thank you. So as Beth said, a lot of the stories that we heard from women in the communities represented some really stark kind of inequalities that we were seeing then in our own research as well. We understood kind of that women from minoritized ethnic communities were facing issues like a lot of women were, but as well as this, some huge structural inequalities as well in terms of menopause treatment and support. For example, here, women from Black and Asian communities are far less likely to get menopause treatment. There are 5 times fewer Black women and 4 times fewer Asian women on HRT compared to white women. And 45% of Black, Asian and minoritized ethnic women reported it took several appointments for their GP to realise they were experiencing menopause. This is compared to 30% of white women. Next slide, please. So as a response to this, we set up a series of focus groups with women from different communities and different age groups to try and understand the key barriers that were at play. And many of these barriers reflected what we see in our HIV prevention work and our other work in health inequalities, including stigma, gendered and racialized discrimination, language barriers, lack of accessible resources. And for many women, this was the first time they'd ever spoken about menopause. For some, it was the first time they'd heard that menopause was something that would happen to them, or something that was happening to them, that we're going through. And this is just some of the quotes from the focus groups that we've highlighted. So when you're Black and you go to the doctors, you get treated differently. Doctors look at Black people as stronger. You need that support from your partner. He needs to understand you. You both need to understand. Money is a barrier to people getting the help they need. So if you want a good cream, it can be £30. Women should be valued. If she's not able to perform in work, they should recognise why women need to have time off when they are starting the menopause. Some men believe that menstrual cycles get rid of all the dirt inside you. They think the dirt is building up now that periods stop. We need to educate men in their groups like we are all here with women. And finally, menopause resources aren't always available. You have to try and find them yourself. Next slide, please. We also asked women what kind of information they wanted access to and what the questions that they really needed answering. And these were some key ones. So what were other women's experiences of HRT? Does it matter about your colour? I got told black people can't have it. What teas can you make? What foods have iron in them? What is a reasonable adjustment? Can you get menopause support at work? What is best, the patch, gel or tablet? How early can you go through menopause? How can we educate our partners? What do you wish you knew before menopause? And why do some doctors discourage HRT? So as you can see, a whole range of topics there. Next, please. So in response to this, we developed the guide to menopause, and the women providing feedback throughout highlighted the need for the guide to cover lots of different topics. So this is what's inside. So we've got symptoms and awareness, menopause and health risks, HRT and hormones, exercise, diet, recipe ideas, water, alternative and holistic treatment, talking, writing and learning, menopause in the workplace, family and relationships, sex and the menopause, menopause and health inequality. We wanted the guide to be as interactive as possible, and many of the women felt that they didn't want just the focus to be on women, but also other relationships in their lives, so family, partners, children. And to include this, we did advice and prompts for partners. We have menopause-friendly recipe ideas, a symptom tracker, and journaling through menopause. So really trying to keep it as interactive as possible. So I'm going to hand back over to Beth to talk about the translations. But if anyone has any questions at the end about the guide and what's included in it, then yeah, please let me know. Thank you.
Thank you so much, Meg. And I feel like this is such a small amount of what's in the booklet as well. It is such a fantastic resource. There is so much information, and I think it really paints a wider picture of women going through menopause. So for the translations, we identified 3 key languages for the women of Greater Manchester. Now, we did this by using consensus data, and we also consulted with various networks and groups across Greater Manchester to make sure that we were listening to the community about what languages were needed. So we have a booklet available in Bengali, in Arabic and in Urdu. Now, these are all available on our website, and we will be sending out the link after this session. But a part of this, we felt it can sometimes be quite difficult to get printed guides out there. So we've also created 2 posters to go alongside of this, and that will be a part of the menopause resource pack. So within the pack that will be sent out, we'll have the English guide as well as the translations, but also 2 posters that you can print out and put along in the community. So the first one is the poster in the middle, and this just promotes the guide and provides a QR code and a link to access it. So it talks about all the different things that are involved in the guide and the languages they are available in. And then on the right hand side, we have a poster that raises awareness of the prescription prepayment certificate for HRT, because currently HRT isn't eligible in a prepayment certificate. So we were trying to raise awareness that it can be affordable. So for £19.80, this will cover HRT for the year. So we're trying to take away some of those health inequalities and the barriers to accessing menopause education, menopause management. So the guide can be found on our website along with the pack. So it's thebha.org/menopause, but this will be put out afterwards in an email. You can download the pack with the posters, but you can also find all the recipes. So there is a QR code to the different menopause friendly recipes within the guide, but you can find them all here. And yes, we will be sending the slides. And another part of the menopause awareness work that we do is that BHA, we deliver menopause awareness sessions. And this is really what fed into the guide, because we had such an overwhelming ask for menopause sessions. So 2 of the sessions that we do offer, but they can always be quite flexible, is we do Menopause 101. So this is an overview of hormonal health and understanding how the hormones affect our body, looking at symptoms awareness and a brief overview of menopause management. Then we offer another session that it really focuses on menopause management, and we look at the 5 branches of that. So that would be diet and the different types of food we can eat and phytoestrogens. We look at exercise and how to build strength and prevent osteoporosis. We look at HRT, supplements, which can sometimes include a herbal tea tasting, which is very fun and a great way of getting women to talk a bit more openly about their health. And then finally, mental health. So now we'll be watching a video called Our Menopause Story. Now, these are 3 women who had a key involvement in designing this booklet. We had focus groups, but also we did surveys, we spoke to women in the community, and this is just a short snippet of their experiences. So the video is about 5 minutes long. I've tried to make it louder, so you may have to turn your volume up, but there is subtitles. Oh, I'll just make sure I'm sharing my sound, because there we go.
If you think about a garden in the spring and summer, it's absolutely beautiful. When you come into menopause, it's like the autumn, so things are still beautiful, but in a different way, but not so vibrant and green. So it's a bit like that.
Oh, 0. Absolutely nothing. I don't think I'd even heard it talked about. Did I know it was going to bring a whole set of changes in me? No conversation with my girlfriends, no conversations even with a doctor.
It was, I think it was a taboo topic. No one really spoke about it. Even as I was growing up, I never heard anyone mention menopause. So I wasn't really prepared. I wasn't prepared at all.
The first thing that I really remember is really bad dreams. So I always had bad dreams and nightmares when it was my cycle anyway, but it was the types of dreams I was having, and that was something that I noticed had changed.
My skin had changed. My skin became quite dry. Hey, my body changed. I mean, I did get a little bit concerned because my diet hadn't changed. My eating habits were the same. And for some reason, my physique had changed.
Went to the doctors and asked them to test me for dementia because my mind was off by a mile. You can talk to me now, and before I've turned my head left to right, look back at you again, it's gone.
When Davina McCall came on the TV, and I went back to the doctor saying, you know, I think I need some HRT, and I couldn't get it because my blood pressure was high. So unfortunately, when you've got high blood pressure, there's no other alternatives that you're offered. But when you do your own research, it says other things, like you go through the menopause and the reduction in your hormones makes your blood pressure rise. So there's lots of things that you're reading, and it's, you know, there was kind of no place to go to really answer these questions. Like your GP doesn't answer these questions.
Menopause support, I didn't hear.
When you spoke to the doctor.
I know, but that was the answer. Menopause support. He didn't say anything about it, so I don't hear in my brain support. I hear you got. I think I'm going through the menopause. I can hear my specialist doctor saying HRT referred, but I didn't hear support as in there is a group you can go to, or the women. No, that's not ever come into the conversation. I think maybe there is an assumption that I'm going to go away and talk to someone, and the answer is no. I took one supplement, I think it's called Black Cohosh. I'm on that one a day, every day, and that kind of lines me up. It's not a cure-all, but it works for me. But I can line up work enough, I line up my caring, I line up my relationship, I line up better than when I was free-flowing, in a lot of pain, bleeding a lot, extremely tired, sleep deprived. There's less of that now. 10, 15 years though of living like that, and it's only within the last year or two that I'm starting to feel okay. So you need to have strategies, because you're going to be in this whirlwind for quite a while if you're unlucky.
I went to see a herbalist, and that was really good because she gave me different herbs to help me. So that was good. So for me, the natural way is a bit better. And then I looked at my diet, started changing my diet. I also went to see a natural nutritionist, which is really, really helpful. And so I eliminated certain things from my diet. So little by little, I was trying to just heal myself without medication.
The menopause, it's natural. Let's talk about it. Let's put women living with HIV in the same spaces so they can talk about it. We've got stuff we can share. Really interesting information. Great, thanks.
Lovely. Oh, there we go. So that was the video. Thank you so much to the women who were part of that. It was really a privilege to be a part of those interviews. We ended up, I think, probably about 3 hours of content to go through because there was just so much to talk about. So yes, so thank you everyone for listening to me and Meg. I'm now going to pass on to Alison. So I'll stop sharing my screen because I know Alison has some slides to share. And Alison will be talking about Hive's holistic approach to HIV prevention.
Thanks, Bethany. I'll just bring up my slides. You have to just give me a yes if you can see those, okay?
Yeah, I can see those, great.
Yeah.
So thanks so much for having me. It's really great to be at this event and to support the launch of what is a really, really fantastic guide. So I'm just going to talk a bit about the importance of a holistic, person-centred approach to sexual and reproductive health and HIV. But I thought it would be useful initially just to give a bit of background to some of the work that I'm involved in our programme to end all new transmissions of HIV by 2030. So most of you will know that Greater Manchester joined the Fast Track Cities initiative in 2018, and in the same year we launched a comprehensive programme of work with a rightly ambitious aim to end all new transmissions of HIV in Greater Manchester by 2030, so not far off now, and also relating to that, ending all HIV-related stigma and discrimination. And alongside that, we've got a set of targets to improve the proportion of people living with HIV who know their status, who are engaged in treatment and who have an undetectable viral load. And we know that we've made some really significant progress within recent years against some of those aims and targets, but there's obviously always more that we can do. And this slide just summarises our approach, which I won't go through in detail, but you'll see we take a really multi-component approach, covering all elements of the prevention pathway. So from targeted primary prevention in terms of condom and lube distribution and targeted sexual health promotion, to secondary prevention in terms of expanding access to testing and supporting early diagnosis, right the way through to tertiary prevention, so ensuring people living with HIV can access the care and support they need and live without facing stigma or discrimination. But it's not just about what we do, it's really about the way that we do some of that work, and there are a number of key principles that we try and work to. So firstly, partnership with the voluntary sector as a really key delivery and strategic partner in this work, and that's been central to the approach and to the success of the programme to date. Alongside that, genuine and sustained co-production with people and communities who have lived experience. And thirdly, drawing on the strengths and expertise of the wider Greater Manchester Sexual Health Network, including a range of clinical leads across HIV and sexual health, and that's been crucial. But really importantly, we've tried to maintain a person-centred approach, so recognising that we need to be respectful and responsive to people's needs in a holistic sense, so not just working in a siloed way and focusing just on HIV, but actually broadening that to support people's overarching health and well-being, including their wider sexual and reproductive health, and indeed their wider health and well-being. And that's both because we know that people living with HIV have broader health needs, obviously, that may or may not be related to their HIV, and because if we're reaching people in general to talk about one aspect of their sexual and reproductive health and promoting prevention and testing opportunities, actually we're missing a trick if we don't broaden that out to other aspects of their health and well-being. So it's supporting those person-centred conversations, giving people the information they actually want and need, and not just the information we think they need and that we want to give them, which is why supporting things like development of this really fantastic guide for the menopause is really crucial to the work that we do. So just to expand on that first point, due to huge advancements in HIV treatment and care over recent years, people living with HIV are happily living much longer, healthier lives, and that means we have an ageing population with HIV. So that's shown on the chart on the left. You can see that that bottom blue line gradually increasing over the past sort of 10 years. And now we know that people aged 50 years and over now account for the largest number of people accessing HIV treatment. So that demographic has significantly changed over the last decade. So we need to make sure that the broader health needs, as I say, of people living with HIV are met throughout their life course. And we know that similar to the rest of the population, as we've just been hearing about, the majority of women living with HIV will experience menopausal symptoms. But in a recent study involving nearly 900 English women aged between 45 and 60 living with HIV, just under half felt they didn't have the information they needed about the menopause, and that left many of them feeling that they were underprepared for that particular stage in their lives. And that was especially the case for women from sub-Saharan African communities, where actually, as we've already been mentioned, the subject of periods and menopause can be seen sometimes as taboo. A slightly older study, now led by the Terence Higgins Trust in 2017, reported actually very similar findings, and one of their key recommendations was around high quality and accessible information about the menopause for women living with HIV. And we know that developing that those sort of culturally appropriate and sensitive communications and information on the menopause, but also on range of other topics is really central to supporting person-centred care for everyone. So obviously not just those living with HIV, which, as this slide illustrates, it's quite a busy slide, but hopefully it illustrates that it's crucial. That sort of information is crucial to shifting the relationship between people and health and care professionals and improving health outcomes. So trusted evidence-based information really empowers people to take charge of their own health and well-being. It supports people to develop the knowledge, skills and confidence they need to more effectively manage and make informed decisions about their own health and healthcare. And it redresses the power imbalance between people and healthcare professionals. And I think that's especially important for sexual and reproductive care, because conversations with healthcare professionals on that topic can be especially uncomfortable and challenging for all sorts of reasons. And as I say, if we can get this right and shift towards those more person-centred holistic models of care, we know that that leads to improved health outcomes and more positive health behaviours. And we know also that it reduces use of GP and emergency services and is ultimately cost saving to the system. So it's a win all round. So that was all I was going to say, but happy to take any questions now or at the end.
Thank you so much, Alison. Does anyone have any specific questions for Alison? No. Okay, brilliant. Well, if you do, we'll save them until the end. So now we will be moving on to Sheni, who will be talking about the impact of the Greater Manchester Menopause Network.
Brilliant. Thank you, Beth. And good afternoon, everyone. Hopefully you're all munching on your lunch while you're listening to this. So I'm going to talk a little bit about the Greater Manchester Menopause Network and some of the work that runs parallel to that, all who are trying to improve both the provision and the services that are available for women across Greater Manchester and wider as well. So the GM Menopause Network comes together to share learning, to share challenges, to promote initiatives and activity that's running across Greater Manchester, and really trying to look at where we know there's great practice in how services are being kind of connected with women across different communities, understanding what the impact of menopause is on different aspects of women's life, and I'll talk a little bit about that in a minute, and where we're able to really collaborate and scale up some of the work, because what we're mindful of is that there's lots of project activity going across, running across Greater Manchester. What we're trying to do is actually get a little bit of visibility for that work, scale up where we know that there's some great practice, support people as much as anything else, and consider where we can influence and connect as a collective. So the group of people include everyone from researchers from our universities to people who are leading services within our communities, to people who are delivering quite broad kind of developments across Greater Manchester, like the health strategy team, and we've been hearing some of the work that Alison's been doing there, which is a part of that network. We know that inclusion across that menopause awareness is an issue, and it's incredibly important. If we think about the intersectional approach, kind of lives that all of our women lead, we need to make sure that our services are also ready to support the broad needs of women, regardless of whatever their individual intersectionality is, and make sure that we are really addressing some of those inequalities. So with that in mind, I think that there are three key areas that the network really tries to focus on. One, which is around service delivery and where we're able to advise people around choice. So things like lifestyle, making sure that people understand, or women understand, kind of the impact of good exercise as a preventative activity, nutrition, mental well-being, smoking, drinking. So there's all sorts of kind of activity that gets discussed there. It's really great. We've got our colleagues from GM Moving on the group, and in fact Claire, who I think is on the call, is one of the co-chairs of the group as well. So it's really fantastic to have that broader lens. The second is around getting that medical support, how women are able to access services when they do choose to access services. And sometimes the reception isn't always a positive one. I can't remember, I think it was Bethany or Meg said that it can take up to 5 to 7 appointments before a woman is actually able to have a conversation about her individual menopause journey. We know that women who come from either Asian or Black Caribbean, African backgrounds are likely to experience menopausal symptoms earlier on. So it's very easy to kind of take some broad assumptions around you don't hit menopause until you're about late 40s, early 50s, if you've got women who are experiencing it much earlier. Pain threshold is another one. Mental health and the intersectionality with mental health is another one. So we know all of these things are really big issues. So really looking at some of those services. Part of that is about making sure that the services are able to have those conversations, are able to understand the different experiences that women have, and almost do some of the myth busting around things like HRT, for example. It hasn't necessarily had the best kind of historical reputation, but it's a great aid for women when they're able to access it. So, and when they are able to access it, comes in two forms. Those women who do go and speak to their medical professional are still a small number in comparison to the proportion of women who experience menopause at the time that they do. And when they do actually experience it, whether they get access to HRT can be down to a number of different things. The kind of the perspective that the GP might take, the availability in their particular area. There's all sorts of different things. So we're just trying to do a little bit of lobbying. So, for example, there is training underway at the moment. We're trying to make sure that each practice has at least one, we're not there yet, at least one trained person around menopause. So a clinician who is able to advise, so everyone will be able to access that. Provision and resources like this booklet, and there are a couple of other kind of provisions across the footprint, are really, really important to help with some of that awareness. So whilst we're looking at kind of what that means for our communities, it's also important to make sure that we take on board that our services also need some upskilling as much as anything else. So there's some work that gets done around that. And then the third aspect of the conversation, and it's quite an important one actually, is how we support women in work. So financial kind of independence is an important one. Women's social economic kind of activity gives women choice, and it gives women the ability to be able to understand how they're able to make decisions about their lives. But we know that a lot of workplaces aren't necessarily aware or be supportive of what that menopause journey might be. So doing some work, doing some influencing around what that might look like, supporting, I don't know, it might be training up our line managers or making sure that our people or HR policies actually acknowledge what that menopause journey might be. So really understanding and really thinking about what kind of support people might need. And it might be something as simple as, if you're in a frontline job and you wear a uniform and your uniform is made of polyester, that's not going to be really great if you're then having hot flushes as well. So actually, can we get some cotton based kind of uniforms in the place? So doing some gentle lobbying and some influencing around things like that is really important. More often than not, it all comes down to money. So actually, the other advantage of bringing the network together is where we're able to collaborate and get some economies of scale. That's really helpful as well. So just trying to keep on top of that. I think it's also really important to, from my personal perspective, because I sit in our health and care system, so just understand what our workforce looks like, because that's a really important part of that journey. So if you think about the NHS or health and care workforce, the average kind of number of women in that workforce is about 76, 78%. So the majority of our workforce, I think it's easy to say, is estimated that about half of that workforce are going to be either perimenopausal or have gone through that menopausal change, so that we know that we've got an aging workforce as well as an aging population. And we know that actually women who come from backgrounds of colour, or those who also have long-term health conditions or any sort of disabilities, also find it very difficult, because their intersectional kind of frame starts becoming a lot smaller and a lot more complex. We know that women are disadvantaged in terms of pay, and I know a lot of organisations are going to be reporting their gender pay gaps at the moment, and that has another layer and impact on whether an individual has the ability to be able to go and buy a cream or is able to go and get an appointment. And some of those inequalities shouldn't exist at all. So lobbying for things like that is really important. We know that women's health generally it has got some inequality. So the UK has the largest female health gap in the G20. It's not great. And that includes things like research, pain treatment, and mental health as well. So they're really kind of key areas. Gynae kind of areas as well. So everything from kind of maternity all the way through to the life cycle of women. And I keep talking about that intersectional approach is incredibly important, especially where we know that all these inequalities kind of exist. So some of the work that's been underway is part of the Women's Health Hubs. So they've been in progress since 2023, sorry, apologies. And across Greater Manchester, we know that we've got 17 women's health hubs in Greater Manchester that have been set up. They're not new spaces, but they're spaces that are providing additional services or enhanced services across that Greater Manchester footprint. And the commitment is that we need to understand how we can continue to make that move forward. There are a number of plans in place at a time when we've got lots and lots of cost cutting going on at the moment to make sure that the commitment to women's health and improving women's health outcomes is still there across Greater Manchester. I think it's important to flag that a lot of the work that we've been talking about, one of the biggest pieces that we've got is how do we share and communicate all of this. So there's actually a quite a growing piece of work around what platforms do we have, how do we share information, things like the resource that we've got here, and how do we make sure that we get some of that spread and approach as well. So we've got some of those core priorities which are really important, and that research is going to carry on. It's going to go on. We've got a team that works across health and the combined authority, the Aging Well team, and they're working alongside a network of universities, so Salford University, Manchester, etc., and looking at the well-being of older women, and that piece of work in particular is being led by the University of Salford. So there's lots and lots of things ongoing. I think the idea is the more we talk about this, the more that we start sharing resources, the more that we start raising awareness and recognizing where those gaps are, it better informs the work that we can do and helps us start to plug some of those. So hopefully some of that has given you a little bit of insight. Thank you.
Thank you so much, Sheni. That was really interesting. And I just think it goes to show what amazing work the GM Menopause Network are doing. Same with the Hive programme as well. Like, it's really lovely to kind of be a part of this panel and kind of showcase all of the hard work, because I think we're all really rallying for women's health and for women to be heard in healthcare settings and empowered and given the information and education they need. So thank you both so much. It's been really lovely to hear you both speak. That now comes to the Q&A section. Does anyone have any questions for any of us?
Hello, sorry, I have a question. Sorry, I haven't got my camera on. Can you hear me?
Yeah, we can hear you.
Yeah, hi, my name's Amelia. I'm salaried GP in Moss Side and Longside. And I'm so glad I came to the talk today, because we have a huge need for help with our women's health and our menopause awareness. We have a really big a patient population of South Asian women. At the moment, it's just me, women's health, GP with a special interest in women's health within the two practices. And I'm doing my best, but yeah, just how do we sort of start collaborating with you, get you involved, get help with our women's health promotion?
Oh, that's a good one. So I think one of the first things we can start looking is maybe kind of distributing kind of the booklets and raising awareness. I think so some of the work that we do, so we do menopause awareness sessions to help kind of raise awareness of menopause. I don't know about Sheni or Alison. I wonder if you have any ideas within this.
Yeah, so first of all, if you're not connected in some way to your local health hub, then please get in touch. Just drop me an email, and we can make sure that that connection is there. Like I say, it's still at the beginnings of the work, but we have got a network growing across Greater Manchester. So we can certainly connect you into there. I think one of the key things that's coming out of all the work that we're doing at the moment is we all wait until we get to menopause or perimenopause, and then we go into action. So there's something about those prevention messages around what good health looks like. So we've been talking about encouraging women to move more. Now, that doesn't mean buying expensive gym kit, going out and getting a membership. It means just understanding how your body works and moving more. So, walking or kind of making sure that your hip joints are kind of as fluid. So when you get to that point where perimenopause starts impacting on you, you're putting yourself in the best position possible. So there's lots of work or lots of conversation at the moment about how we can focus on that more prevention message, so we don't wait until we get to that point where the intervention is needed, and it's a lot more, the impact is a lot more prevalent on individual health. I don't think there's a golden answer to this, to be honest. I think we've just got to all keep chipping away, and it's one of those small actions collectively can start help to create a bigger impact. So I think if everyone does a little bit and we all move in a similar direction, then we will eventually get to a tipping point where women's health is in a better position.
Thank you, Sheni.
Great, thank you.
So yeah, Amelia, just to reiterate what Beth said as well, we can definitely, provide you with some booklets and the links and everything after today. And like Beth said, those sessions that we do, particularly if you're saying, large community of South Asian women, how we can start tailoring like our resources and information that we're giving out to different communities. So that can, definitely be a discussion that we have. And we can connect you with everyone else on here as well.
Amazing, that's great. Thank you. I'll be in touch. Do you do menopause awareness sessions in other languages by any chance?
So I'm afraid not. Have a lot of the work that I've been doing for the last couple of years, I work with a lot of South Asian women. I do work with South Asian women's groups, and what we tend to do is we'll take it into, like, we'll ask different members of the group to help translate. So when it comes to kind of, we're trying herbal teas or we're looking at supplements, we'll look at the words in Urdu for them. But we have to be kind of quite flexible with it, in that we'll lead the session, but we'll ask the women to kind of help translate. And we often encourage women to kind of have conversations in their own language, and then we kind of like translate back, and quite free flowing with how we manage our sessions. The main things we try and get the information out there and help women just feel a bit more comfortable talking to each other. One I think things I've learned the most is actually it's been other women speaking to women who have learned the most. I've just sort of facilitated the conversation.
Great, yeah, that's a really good idea. I think that would work well with our women as well. Urdu, Punjabi, Bengali, be brilliant.
Perfect. I'm just we'll send out the slides. I'm just going to pop in my email to the chat if anyone wanted to contact us. It would be the general kind of PASH email. If anyone would be interested in hearing more about kind of our sessions or the work that we can do around menopause. We really try to take a holistic approach, so we're always learning from our sessions, learning from the community, learning from women, and trying to tailor that support. So any feedback is always really, really welcome. Also, I'm just going to read out Claire's message. So there is a member of the Menopause Network who is looking at a project to develop menopause champions from global majority communities in India. It'll be worth thinking about if she can connect with any community groups local to Moss Side. So yeah, that's definitely something maybe to get involved with the Menopause Network. One of the projects that we're kind of looking at doing is maybe doing some menopause awareness videos in different languages. So once we've kind of started to develop those, we'll be able to send those out as well, because we're really trying to help tailor those messages and just spread the word far and wide. Does anyone have any other questions? Well, in that case, I think we have finished early. Thank you everyone so much for joining us today. It's been a really lovely session, and just really lovely to celebrate this amazing resource. I just remembered I've got one final thing as just a little thanks. I forgot to stop sharing my screen. We have quite a few thank yous because although BHA developed this guide, there was a whole team of people who were involved in this. So this was the project was funded by Manchester Integrated Care under the Hive project. We have several clinicians we'd like to thank. So we have the HCRG group, we have the Northern and the GM Menopause Network, all of the Greater Manchester commissioners that were part of this work, Jen from 711 who did the design, and Shilvan de Costa who did all the illustrations. We have the PASH partners as well, women from the menopause focus groups, Yvonne Richards Cooper, who was part of the video, who works at George House Trust, was a big part of this and ensuring that the voices of women living with HIV around menopause were involved. Alison and Sheni, I'd like to say a big thank you. It really was lovely to have you a part of this event today. And thank you so much to everyone who has joined us.
Thank you.
Thank you so much. Take care.